Welcome, everybody, and hello to our first live session on contraception and sexual health. My name is Ralf Bannemer-Schuld. I'm a medical doctor, and I work in medical department for women's health and contraception at biopharmaceuticals in Berlin, Germany. And as soon as I'm outing myself where I work, everybody has questions about sex and contraception, and it's totally okay to talk about that openly, because it's so important, and that makes us providing you with that unique opportunity today to comment yourself and to ask in the comment section on your specific questions you may have. Please be aware there are no stupid questions, there are only stupid or wrong answers. So don't worry, don't be shy, provide us with your thoughts, experiences, and most important questions you may not even dare to ask sitting in front of a doctor or your friend or your parents or so. So please use that opportunity. And it is important in an area where women are really confronted with the fact, and human mankind is confronted with the fact that more than 44% of all pregnancies worldwide are still unintended. It's unbelievable. And this percentage is constant all over the last decades. So almost half of pregnancies occur unintended. Why is that? People don't have knowledge about contraception, obviously, and many people do not have access to adequate contraception. That is really something which should scare all of us. So important is the availability of contraception cannot so much be changed by us, but the knowledge about contraception. And that's what we're going to do today. Be aware, it's your life and your future, and it is our aim to enable you to make an informed decision and to be ready for love and contraception. So we want to give you the opportunity to ask your questions on many hot topics around contraception and sexuality. To keep it short and simple, we have selected a number of topics for today from our Facebook or Insta channels, where we get a lot of questions from our audience anyway. In the next 45 minutes or so, we would like to talk about the menstrual cycle, the pull-out method, condoms and their role in the prevention of sexually transmitted infections, and also about hormonal contraception, like the pill, for example. I have to say, the only thing we cannot do today is to give you individual and personal medical advice. The reason is that for personal advice, you will need to see or speak to your healthcare provider. That can take your personal situation and medical history into consideration and make a recommendation. But we will do our best to answer any more general questions you may have. And to do so, we are joined by a special expert today. I am happy to introduce to you Dr. Tlaleng Mofokeng from Johannesburg in South Africa, well known as Dr. T, from her blogs, Facebook, YouTube channel, as well as from TV and radio. Dr. T is working in the area of sexuality since more than a decade, and her work is focused on advising young people. Welcome, Dr. T.
Hi, Ralph. How are you?
Fine, thank you. I hope you are also well.
I'm very well. It's a beautiful day today in Johannesburg, and I'm so excited to spend this World Contraception Day with you on this amazing platform.
Exactly. We have today World Contraception Day, so it is more than justified to talk about contraception today. Of course, while waiting for the first questions on contraception from the chat, from the comment function, it's worthwhile to mention that there's hardly anything in female biology which is more mystified than the cycle, the menstrual cycle, and the menstruation itself. Dr. T, what are the most frequent myths you are facing with when talking to young women specifically?
You are so correct, Ralph. I think the menstrual cycle, when it comes to the bodies of women, is just full of myths and misconception. And sometimes, unfortunately, some negative thoughts and ideas. And I think as part of me doing my work, I always spend time talking about the menstrual cycle, giving some more positive information about the importance, of a menstrual cycle for all of us. Because I know, being a young person myself, not too long ago, I used to be so frustrated that every single month, ever so often, I have to deal with this menstrual cycle. And some of the concerns, that many people have and patients have related to menstrual cycle is that it's actually quite painful. It's uncomfortable. It causes bloating, right? And so you are already physically feeling unwell. And then you still have to go to work or go to school and be productive and perform at your best. And I think because many of us don't have enough pain management and enough good medicines, to take care of the pain and the premenstrual syndrome discomfort, we are then just really just uncomfortable too long and too often. And I think it's just even in my own way of how I speak to my patients, I always ask them, how is your quality of life during your menstruation? And to validate and affirm the feelings that they may have, even if they are those of frustration, and even those that may be slightly negative, so that I can get to understand exactly for them what they need for that individualized care and service. Other myths are related to the length of the menstrual cycle. Is it too long? Is it too short? And sometimes some people may be a bit concerned with the type of blood that then actually ends up being shed during the menstrual cycle, wondering about clotting. Sometimes some people may have other gynecological problems. And I always remind my patients that a menstrual cycle is normal, but there are other abnormalities that may happen, and you may have other gynecological problems that we need to consider at the same time. But yes, you are correct that the myths are vast and the misconceptions are vast. And I think that's what's so important today, so that everyone gets to understand what the menstrual cycle is. And I'm sure we'll go into the details of what is the menstrual cycle, so that people can then better make choices for the type of contraception they want. When they understand how the menstrual cycle works, then they will understand how their contraception works, and then understand the efficiencies that are required to make sure that their contraception also works well.
Yeah, many thanks for that answer. That already gives us some light on the most important issues around the menstrual cycle. And it's also worthwhile to mention that a woman in these days, at least in the Western world, is affected by more than 450 menstruations during her fertile life. So more than 450 times she goes through the same cycle and through the same pain and the blood loss and all these things. So that really, it consists of a very important part of her life, regularly reoccurring, and how to deal and to manage with that, with the amount of bleeding, for example, or with headache, pelvic pain around these days. That is something where many people, I think, are able to tolerate even heavy pain and heavy menstrual bleeding, which is medically treatable, by the way. Yeah, so that is something where women should speak up also in front of her doctor. Yeah, so that is. For example, a very important topic, and I think that is where women may also need to get some insights into, because it's so difficult to measure that, for example, yeah, for a doctor. So a woman needs to speak up proactively. Of course,
Absolutely.
yeah, please, if go forward.
Yes, and I was going to say that, and what's so important, and why this discussion with us today is even more important, is that many people don't actually know or feel comfortable enough to ask these questions with their healthcare providers. And I always say, to women, keep a diary and just not note down the symptoms that you have that are giving you the most problem, and write down where it is in the month, so that when you go to your doctor, they can see a trend if it's happening. They can see where in the cycle you are experiencing certain symptoms or certain complaints that you may have. And I think it helps a lot for you to understand how your body works and understand your own normal, because my body is not the same as someone else's body, and our hormonal systems are not the same. So we don't even react to the same way, to pain management, for example. So it's very important to write down how long your menstrual cycle is. Jot down if there are any other associated symptoms that you see. You need to note the color and how long you bleed for, if there are any clots there, and write down what improved the pain so that the doctor knows. So when they're prescribing you for medication, they know what you are already taking, and they can see what else to add on to optimize your medical care. And I think it's important that women and people who menstruate understand that they don't have to live in chronic pain. It took me so long, Ralph, to realize that I was actually experiencing very, very severe period pains, but I thought it was normal for me to suffer every month and be in pain, because I just thought, well, that's what happens. And actually, it doesn't have to be that way. So I just want to encourage, young people, anyone who is still experiencing, pain and a lot of pain, and a threshold may be high. Please consult with your doctor and get some pain management and optimizing of the pain management. And if you want me to, I can go into the different phases of the menstrual cycle, just to explain to people.
Sorry to interrupt, but we have the first questions in the comment section,
Okay.
so then we can go real live. Of course, an important question, because that is the reason why I dare to interrupt you. Can I get pregnant if I'm on my period? So more practical questions about sexuality and can I get pregnant if I'm on my period?
The simple answer is yes, you can. And the reason why you can get pregnant even though you are on your period is that when we ovulate, this means that the egg is mature in the ovaries, and you can ovulate close enough to your menstruation. So when you see the blood coming out, it doesn't necessarily mean you are infertile for that period. Some people have a 28-day cycle, some people have a 21-day cycle, some people have a 30-day cycle. And so it's very important to understand that if you don't want to get pregnant, you have to take steps to ensure that you are on an effective contraception. It's the only way to be 100% sure. And even then, some contraceptive methods we know, and we can discuss in details later, some of the things that make them not work so well. So the simple answer is yes, you can still fall pregnant, because sometimes, in fact, and this is something really fascinating. People will often tell you that I still had a bleed even though I was already pregnant. So our bodies are really, really fascinating. Sometimes you can already be pregnant and still have a bleed. And sometimes you can have your menstrual bleed, and if you are having sex at the time, get pregnant, because you could ovulate soon after that period. And remember, sperm can live up to 7 days. So
Yeah.
if you have exactly, so if you are bleeding today and it's your last day of your bleeding, and you are ovulating in the next 4 or 5 days, and you are having sex on the last day of your period, you can still get pregnant, because that sperm will linger around in the fallopian tubes for up to 7 days.
Exactly, and these sperms are good swimmers. Yeah, they can
Yeah.
reach out to the egg which is ovulating. Though that needs to be taken into consideration. Thank you for clarifying that, because that misunderstanding obviously also contributes to some extent to that 44% of unintended pregnancy. I'm very sure.
Absolutely.
Next question is, how will contraception affect the period? And I think that relates more to hormonal contraception, I would say.
Mhm. And we need to say this and remind to everyone, and I get this question a lot even in the clinic. When you are on a contraception, what you are seeing as that blood, that's cyclical, that's predictable, we don't call it menstruation or we don't call it a period. It's actually a breakthrough bleeding. And it happens because there's a decrease in the amount of hormones that's being, released into the body for about 5 or 7 days. And that dip, that low dip in the hormones, leads to a breakthrough bleed. Now, this is something that happens commonly with the pill. Many of us are familiar with the pill, that sometimes it has one color of tablets that you are taking for most of the month. And then there's a week where you are taking a different color of tablets. Sometimes in some of the other countries, the pills are still 7 days. In some of the newer types of the pill, which have the lower dose, some of those pills are only 4 days. And for those 4 days or for those 7 days, what you will see is blood, but we call it breakthrough bleeding. And that's literally just because of the decrease in the hormone in the blood. And it's not a period per se. But again, Ralph, talking about those misconceptions, there was this idea, I suppose, when the pill was being designed, and it's 60 years old today. So it's the anniversary of the pill. It's 60 years old. And there was this idea that women would still like to see a monthly bleed. And so this 7 days or 4 days of hormone-free days was then designed into the pill. And therefore it happens. But it's not really truly a period, it's a breakthrough bleed. And with some other contraceptives, some women don't see any bleeding at all. And the bleeding will only come back once they've stopped that contraceptive, like the intrauterine devices or the implants that go into the arms.
Is that something bad if bleeding disappears under contraception, or what do you think? Is it bleeding at all necessary?
So it's not necessary to have a bleed while you are on a contraceptive. It's only for those people who really want to see that bleed. They can if they want to, but it's not necessary. And remember what the hormones are doing when you are on a contraceptive. They stop that phase of ovulation. So from when the egg starts to grow and the egg gets mature and it develops and eventually ovulation happens, contraception stops that process of the egg growing, of the egg maturing and developing and then ovulating. So that process is stopped. Then you do not need to have a period, because then your uterus, the lining in your uterus, will remain thin, because also the changes that happen to prepare yourself for menstrual cycle include the shedding of the uterine lining, because it has been thickened throughout the menstrual cycle to prepare for implantation if fertilization occurs. So if you are on a contraception, there's no ovulation, therefore there's no fertilization, therefore there's no implantation, which means that the lining in your uterus will remain thin throughout your cycle and throughout the months and the weeks, and therefore it's not necessary to then shed that lining and then see the blood.
Many thanks for this very clear statement. Now it's time to move to another very important topic, also to some extent contributing to that high rate of unintended pregnancies, I think. Um, it is the so-called pull-out method. You know, Dr. T, may you explain it in a few words so that everybody knows what we are talking about while waiting for the questions to come about that topic?
Yes, so the pull-out method, and I find it fascinating, right? That it doesn't matter how old or how young the patients are or the clients are, everyone seems to be constantly asking about this pull-out method and is it effective? And my answer today is that the pull-out method is not an effective way of not getting pregnant. If you know that you do not want to get pregnant, you have to consider other more efficient and evidence-based methods of contraception. Unfortunately, the pull-out method doesn't work for a few reasons. Firstly, it can get quite difficult while you are having sex to remember to pull out, right? Because
Right.
the climax happens and the crescendo happens and the fireworks happens. So it's not guaranteed. And secondly, we need to remember, which is very, very important, the seminal fluid can still contain sperm, even though you don't ejaculate. And it only takes one sperm to fertilize an egg for pregnancy to happen. So even if it's before you have ejaculation, that fluid, and a lot of young people call it the pre-cum, that fluid still contains enough sperm to lead to a pregnancy. The other important statistic is that 22 out of 100 women who rely on the pull-out method will get pregnant every year. And that is a very high number. 22 out of 100. It's very, very high, which means that this method is not reliable. And as a medical doctor, I wouldn't, uh, consider it even for patients and consider it a method per se. And for some people, unfortunately, they may have other reasons why they don't want to take contraceptives, but it's important to consult. And I think this is why, Ralph, even the conversations we're having today are really designed to give people information for them to be able to consult and ask their doctors and nurses the good questions that they need for themselves. And don't be shy to ask about other methods of contraceptive. Maybe you are being offered the pill. Ask about other methods. Maybe you are being offered an injectable, and in your clinic, that's all that's available. Ask about other methods that are good for you.
Yeah.
And talk about the fears that you have about taking contraception, as opposed to relying on methods that we know don't work well.
Yeah, many thanks for that very clear statement. That reminds me on a talk I once had with a professor in sexual medicine, and he once told me while drinking together with me a glass of wine, said, well, Ralph, I can only recommend contraceptive methods which are still valid after the second bottle of wine. If you have a dinner in the evening with a girl you fall in love and you want to have sex and you decide to have sex with her and she agrees, please use only a method which is really valid after the second bottle of wine. And pulling out is not a method we can recommend in these circumstances. So it should be dealt with and considered adequately. While we do not have so many questions about the pull-out method, there is still something which should be dealt with. And a very important question is regarding estrogen and migraine. That is obviously something which does not totally fit into our series of topics, but it is important as it has come up for various times, and there is still pros and cons and discussions about it. But what can you say about estrogens and migraine incidence in women taking contraceptives?
In fact, I used to suffer a lot of migraine. So this one is even a personal experience that I'm sharing. And when I wanted to then go on a contraceptive, I remember my doctor, and at the time there was also a nurse. During the consultation, they asked me symptoms, do I suffer already from migraines, water retention, tenderness around the breasts, those types of symptoms. And at the time, I didn't realize that they were actually linked to my hormones and my cycle. And this is when I started to think about the hormonal cycle as an orchestra. Sometimes there's certain instruments and others may be too loud and be louder than the others and overpower the others. And that's how I started to think about it. And for me, actually, what became apparent was that my migraines were actually caused by the sharp increases of estrogen throughout my cycle. And so by the time I then went to consider taking contraceptive, my doctor also considered the fact that I was already a migraine sufferer, so that when they then looked at what types of options to give to me, I took a lower dose estrogen combined tablet because I was already, experiencing migraines. And so it can happen with some women that they experience migraines. It can happen, though, that with the right choice of contraception, their migraines actually recovers, the water retention goes down. And I've actually seen that in a patient of mine recently who was on a different pill. And all it took was us to just consider the symptoms that she was already having and then choose a milder, lower dosage of a pill that was available in the market. And immediately with that, just those first 2-3 weeks, there was already a difference in her quality of life and definitely in the symptoms. And of course, we will know that even when you are much younger, the young girls who are still going to have their first menstrual cycle, often they will suffer with headaches and migraines, and we may not be paying attention, right, to the fact that puberty is happening and all these hormones are starting to have an impact on their bodies. And sometimes I often remind my patients, you need to be paying attention. If your daughter starts to complain of a lot of headaches around the time of your puberty, start to speak to her and offer, the right sort of pain medication. But definitely, even those of us who are older, who may be on a contraceptive, sometimes it can worsen, but sometimes if you're on the right contraceptive and you've considered all of your symptoms before, you can be able to get recovery and be covered quite well.
Yeah, thank you for the personal experience. I can also add to that changing of your contraceptive may in these circumstances be a good choice, to try. My wife also was suffering from a migraine a lot, quite regularly, 3 or 4 times a month while she was on the contraceptive pill. And then she switched over to a hormonal coil, and then her migraine stopped immediately. Since then, she never got migraine again, due to the fact that there was no estrogen in that hormonal coil, just a very low amount of constantly released progestin, which obviously seemed to help her in that. By the way, her bleeding also disappeared. That was
Yes.
also a nice event, and provided her with much more power. But the migraine disappeared, and that, of course, may be due to individual predisposition, and there is not one solution which fits all. But there is at least a chance to get an improvement. That is, I think, what can be told in these circumstances.
Yes.
Another remaining question from the last topic is, how long can I be on depot contraception, I would assume, before it becomes potentially harmful? Is there any time threshold which you would recommend, or is there no time threshold for longer use?
Yeah. So we know with that particular injectable is that one of the biggest concerns, and as a medical doctor, I always have this discussion with patients, is the issue of bone density. Some of the negative side effects is that it can really decrease the strength and the health of your bones. And this can happen almost immediately within the first year, and definitely within the first 2 years. Some of the most negative impacts on your bone health can happen. So if you are someone who already has a history of osteoporosis, or in your family there's a history of osteoporosis, you need to consider the use of the depot injectable quite carefully. Some of the side effects include hair loss. Some side effects include some issues around memory, definitely water retention. And the one that I find impacts women immediately in terms of their quality of life, it's sometimes the heavy bleeding. It's unpredictable, the bleeding, and sometimes it can go on and on and on for many cycles and sometimes for many months. And that has impact on sexual health. It has impact on sexual pleasure, and definitely it has impact on the quality of life. And I remember sometimes, in my previous life when I used to work in the mine as the mine doctor, a lot of women who needed to work underground couldn't do so for those periods because of just the heavy bleeding. And that's when I used to talk and discuss with them, menstrual health products such as using the cup, because the cup, at least, it's inserted in the vaginal canal and it collects the blood in that silicone cup, and the seal just makes you feel a little bit better, and you can work because you are not constantly dealing with having to change a pad or a tampon. So the bleeding is so unpredictable and sometimes can be so much that it leads to issues like anemia, where your iron levels and your hemoglobin is impacted. And so you need to consider it well. And I particularly am an advocate for more of an increase to modern contraception methods. I think there are so many other methods that could be and should be made available even in the public health sectors, especially in the countries of the global south. I'm in Johannesburg, I'm in South Africa, and I know that even in the region of Africa, I know in Asia as well as South America, many countries and many of my colleagues and peers are still struggling with access to modern contraception. And I think we have to do the work of advocating and advocating and demanding that governments make sure that women have access to more modern contraceptives, because our lifestyles, are so different and so vast, and we need our bodies to be able to do so many different things. And I think having a good modern option, quality option, is really, really great. And so personally, I consider the use of depot and the injectables very carefully, and understand though in some instances people don't really have a choice, Ralph. You
Yeah.
either have the injectable or you are left with nothing. And so women
Mhm.
are making sometimes really desperate choices. And are they really even choices if you don't have options really available to you? So we have to talk about availability and access as part of the rights of people, but also to improve the lives of women and decrease some of these negative impacts, especially on our bone health, hair loss, and the unpredictable heavy bleeding.
So we can hope that some politicians and decision makers are also listening to our channel. That is very good. Accessibility, of course, is also a problem, and availability. That is something where the politicians and society needs to join the game to make them available, and also to allow for a free access to that. That is so super important. Um, Thank you for that. By the way, all listeners, if you have more questions on the respective topics we are dealing with, please check out also our frequently asked question page. The link to that chat is just pasted in the chat. So there you find much more information on the certain topics. So, moving on to condoms and STIs, sexually transmitted infection. Starting with my personal experience, I bought my first condom when I was 16, and in preparation for a trip to Berlin with my school class. Um, and but I didn't have the opportunity to use it during that trip, unfortunately. So, in fact, my first sex experience I made totally unprotected, as many other people did. Yeah, so
Wow.
I'm not a good role model here, I have to say. And many questions around condom use begin with what to do, right?
Mm.
So, what to do if the condom breaks or slips off during sex?
That's a big one. And you have to stop immediately. So if the condom breaks, or there's even a question of whether you have put it on properly, or it comes off, you have to immediately stop. Remember, we spoke about the fact that even if there has not been ejaculation, that fluid that's there still contains enough sperm for you to get pregnant. And when you are using condoms, you are using them for the benefit because it also protects against sexually transmitted infections. It forms that barrier that is protective. So when that barrier is no longer there, you are at risk of sexually transmitted infections. And I know that many of us, we know and we hear a lot about HIV, and it remains important as an STI to prevent. But we also have to talk about other bacterial infections like your gonorrhea. We need to talk about chlamydia, syphilis. We need to talk about herpes, right? Some of the viral infections, because they are also just as important. Some of the bacterial infections, in fact, can lead to destruction of your tubes and healing with scarring and chronic pelvic pain. So you have to stop if a condom is firstly applied on and it's not properly, it's not sitting comfortably, if it bursts or if it slips off during sex. I'm hoping that people have other condoms available to them to then immediately replace. Unfortunately, if you don't have another condom in your disposal, you are going to have to stop, call it a day, and make sure that you get your next, supply of condoms. And and what's fascinating about condoms, Ralph, is that the FDA have recently issued new improved guidelines, and we are now calling the male condom. It's now called the external condom, and what we
Mhm.
used to call the female condom is now called the internal condom. And it's important to degender safer sex tools because people who are having sex are not just heterosexual people who are having sex with a penis or a vagina. There are many other body parts involved in sex, and there are many other people involved in having sex who are not just male or female. We have transgender people who also need to be able to use condoms. We have homosexual people who also need to be able to access condoms. So by removing the gendered terms, the idea was to be more inclusive, because now we know that the internal condom can also be used for anal sex. It's very, very important to talk about safer sex tools for everybody. So even the latex condoms need to be accessible in a square, so that for those who are then doing oral sex or having vaginal fluids exposed can use the latex square, as opposed to the traditional external or internal condom sheath. So access to condoms have to be degendered. And as people who've been advocating for this for many years, we were quite pleased that the FDA has reclassified and renewed the indications and the naming of these very important safer sex tools. So just to get back to the question, if the condom slips off, it bursts, or it's not applied on properly, you have to stop and get a new condom. You can't reuse condoms. It's very, very important. You cannot reuse condoms, because the integrity of that latex or the other material that's used on condoms is heat sensitive, it's sensitive to friction. And so once it's opened and you've applied it, you can't reuse it.
Okay, many thanks. That already answers the second very important question about the reusage of condoms. And that brings me back to the second bottle of wine test. Yeah. So after 2 bottles of wine, I'm not so sure whether I would be still able to follow these advices with a clear mind. Honestly, there is another question from the chats asking, what do we do if the condom broke and we stopped sex, but the one partner is positive?
And I'm assuming they mean HIV positive, because usually that's the sort of health status that people talk about. So it's important to remember that you have some treatment, management, medication available for you to use if maybe your partner is HIV positive and you are not, and the condom has burst, because there is a window of risk for transmission. To decrease your risk of then having HIV transmission or acquisition, you have to take what we call post-exposure prophylaxis for HIV, and is a set of antiretroviral medication. They are tablets that you can take up to 28 days. In different countries, there's different combinations that are available. In some countries, you are now only taking one combination pill, which means that one pill has more than one antiretroviral medication in it. In some countries, you still have to take one or two separate tablets. But the point is that you do have something that you can do. It's time sensitive, so you can't take too long. You have to consult your doctor or your nurse, or present yourself to your nearest healthcare provider within 72 hours to start the post-exposure prophylaxis. If you are also not on a contraceptive, you then have to think about what you need to do to prevent an unsupportable unwanted pregnancy. And at the same time that you are consulting for the post-exposure prophylaxis for HIV, you can have the discussion with your healthcare provider about giving you access to what we call the emergency contraception. In most countries, it's still the pill that's been used, and it's used in a different dosing than the normal pill. So you need to consult if it's for emergency purposes. And sometimes in some countries, up to 5 days, we are able to insert the intrauterine device, such as the loop, the coil loop, or the one with the hormones, and that can also assist. But we know that generally, especially in Africa, Asia, and the Southern American countries, access to intrauterine devices in public health services is not as good in terms of rollout. And so we still depend on the use of the emergency oral pill for prevention of pregnancy, but where you do have access to an intrauterine device, you can also get that inserted. And definitely the antiretroviral treatment is post-exposure prophylaxis for HIV, and that is also available within 72 hours.
So many thanks. That is very important, of course, specifically in those regions and areas of the world where HIV positivity is a topic, is an important issue. But this also, to some extent, holds true for Western Europe even. So that is nothing which is really limited to Africa or so. HIV is still an issue. Although people may think, oh, well, with these antiretroviral therapy, there is no danger at all. I think that is really also a misunderstanding which needs to be clarified. But having said that, if the condom broke and one partner is positive, there is no other choice, than what you recommended. Many thanks for that very clear statement on that. That, I think, gives now opportunity to change the topic to the, let's say, hormonal contraception, the pill or others. And that is it, or makes it also for me to introduce into the topic, because for me it's easy to remember that the contraceptive pill was introduced 60 years ago, as my mom got pregnant with me unintentionally as well in 1960. So personal experience is highly integrated into today's session. She got pregnant almost immediately before the pill was available in Germany. Yeah, that was, so I'm here because the pill was so late.
That's fascinating, Rolf.
Indeed, it is. Once I asked her, she admitted that this was really the case. So I know the birth date of the pill very well. And during these 60 years, it became, I think, one of the most life-changing medications in the world, maybe only superseded by the invention of penicillin 20 years before. Yeah? So there is hardly any other medication which made such a big game change, I think. And it is worthwhile also to say that today the pill is still so successful because it's so effective and in general safe that it is still used by about 100 million women all over the globe in this moment. Yeah, it has been proven in big studies to be very effective if taken regularly, of course. And it's also safe if doctors prescribe it to the right woman. And so that is also important to mention. In most of the countries, it is prescription-only medicine, and doctors should really check carefully for any contraindications. And migraine is also something which should be dealt with. So many questions around the pill are like, well, which pill is the best? Will the pill put me on weight? So starting with the more general one, is there any best pill, or what would you recommend? What are your experiences with a pill prescription?
So you are correct. I mean, the pill was a big changer, a really game changer for many women, and it's particularly important, to think about, gender equality, for example, and how the pill ensured that women could be in charge of their own lives and their own health, right? And take decisions. And those are like such important fundamental decisions that women should be able to make, around their own healthcare, and access to commodities, access to health products that then assist women with these choices they're making is really, really, really important. And I know that all of us in this session, believe in ultimately the belief that women should be able to decide if they want to get pregnant, when they want to get pregnant, and how many children they want, and how to space that. And the pill really offers women that choice and that opportunity. There isn't one magic pill. All the different pills have a purpose, and they have the best person, right, in mind or designed for. Some pills only have one type of hormone, and this one particularly is good for people who are in the postpartum period, if you've given birth, if you are breastfeeding. There are different types of pills with different types of hormones, because we know that the pill, or at least the hormone, can still be found in the breast milk. So if you are breastfeeding, for example, you need to consider what kind of pill you want to be on immediately after you give birth. There are other pills that are called combined oral contraception, which are combined with an estrogen, progesterone, and that combination mimics what would be naturally produced by the body. And that's why the pill has worked so well, Ralph, is that it mimics as much as possible the natural hormones that would have been secreted by the body. And why they are successful is that the pill is given in the right dose to prevent ovulation. And the modern types of pills have less and less and less side effects. I mean, we've spoken about the issues of migraines, water retention, poor sleep is another side effect that many women complain about. And so with the combined oral pill, we find that at the lower dose, the side effects of those pills, or at least what women will feel, also is improved because they are lower dose. I've spoke about the progestin only tablets, which are also still very useful in other treatments. I know that we speak about the pill, right? And we speak about contraception, but there are many other important uses of the pill as a hormone. And it's important to consult with your doctor if again you think that you are experiencing excessive bleeding, you are having clotting, or the abdominal cramping, it's happening in your cycle where you are not expecting it to be happening, because it's possible to have other gynecological problems like endometriosis, like fibroids, like polycystic ovarian syndrome, and being on the pill is not necessarily going to immediately assist, although we know that in some of these conditions, the pill is one of the methods that are used to treat. So the pill is good for contraception. It's also good for other uses. And I think it's important, especially for young people, to understand that just because someone is on the pill doesn't mean they're on it only for contraception. It's possible, but there are other uses of contraception. And that's why I always talk about stigma-free services, non-judgmental services, so that we don't make it, we don't judge young people who are seen to be on contraceptive. We need to understand that there's very important uses of the pill, and it's very successful as a contraceptive, and it's also very successful to assist with other gynecological problems. And I just want to remind everyone, the pill works really well, but you need to remember to take it every single day at the same time. You need to remember that if you are on detoxification, if you are taking tinctures, you are taking this detox tea and this other detox substances, that the pill may not get absorbed properly. And therefore, the quantities in your blood will be less, and therefore you risk the egg then maturing. The other thing is that if you're on an antibiotic, it doesn't matter how long you've been on the antibiotic for. When you are on the pill and you are taking an antibiotic, please remember to then use condoms, because it gives you a second protection, because we know the antibiotics again makes the pill not work as efficiently. And I've had many women who have an oopsie. They have a tonsillitis or a lung infection, and they forget, or maybe some didn't even know that the pill has an interaction with antibiotics, and then they do end up with a pregnancy that they do not want. It's important to still remember the symptoms of pregnancy so that you can consult early with your doctor if you think you are pregnant, and discuss with your doctor or your healthcare provider what alternatives and what options you have. It's very, very important for every single contraception, including the pill, to know what makes it work and what doesn't make it work so well.
Yeah, many thanks for that. That provides me also, when looking into our chat, what has been asked on that topic. You mentioned modern contraception some minutes ago already, when talking about bleeding for example. What would be your, let's say, list, your top 10 or top 5 of modern contraceptives which you would take into consideration? What would you recommend as so-called modern contraceptives? What falls under that category when you think about that?
Mhm. So the intrauterine device, a hormonal one or non-hormonal, work very well. The patch is another formulation of hormone. So it's like a square patch that you stick onto your body, and the hormones get absorbed through the skin. You then, of course, the pill, the lower dosage pills are still really, really effective and work very, very well. And then, of course, in terms of what's available, depending on where you are in the different countries in the world. You may even have the lower progestin only pill that's still available, or the oral, combined pill, which again has to be the lower doses. And I think that those for me are my favorite ones. The two intrauterine devices, one is hormonal, one is non-hormonal. The patch, the combined oral contraceptive pill, and yes, works really, really, really well. The vaginal ring is very popular, and of course a modern option that also works really well.
Yeah, so many thanks. That would also have come to my mind if I would be asked about that, because that also deals with different levels of comfort, of inserting, of
Yes.
taking or not. The patch has to be changed on a weekly basis. The vagina ring can be taken for 3 weeks in a row, and then a 1 week of pause, but you shouldn't forget to take it again.
Take
Yeah.
it back. Yeah.
That is also the restart of something which needs to be done regularly, is very, very important, as is with a pill. And sometimes for me, it appears that taking 1 pill per day in a certain regimen is sometimes easier to remember. But this, of course, is dependent on your personal, let's say, life and your circumstances under which you live. So that is more or less dependent on how you are living and are you forgetful or not. For some women, also the intrauterine device or the coil, hormonal or non-hormonal, may be a good choice, because that is, once being fit, you can forget about that for years, which is of course also an advantage. And in case of the hormonal coil, your bleeding may go down or even disappear. As you said, it is not necessary to have the bleeding, so you can spare the blood, yeah,
Yes.
and increasing your power. Not to forget that global anemia also is a problem, yeah, which uh, affects boys and girls until the age of 10 years to the same degree, but then the girls have much higher degree of anemia. And what is it
Absolutely.
all about? It is the menstruation, yeah, which makes it really problematic. Incidence is much higher during fertile lifespan, and getting older after the cessation of menstruation, then the curve's going down again to the men's incidence. So there's clear correlation of anemia during the fertile lifespan of a woman and her menstruation. And so
Yeah.
reducing blood loss is something which makes it possible. And I know how my mother felt when she lost blood to a huge extent, suffering from HMB, heavy menstrual bleeding, after the age of 40. She felt so tired. Yeah, she was depressed, and that can be avoided by proper treatment. That
Absolutely.
is that is something. So we could talk for hours, I think, around the topics. Once again, I would like to make the audience aware that still you can have further questions, but you can also check out the frequently asked question page. There are many different types of pills, of contraceptives, which may suit you. Please make yourself, inform yourself. And yeah, what can I say? I really enjoy talking to you and very openly about the topics of contraception. Many thanks also to the audience, to the great questions and openness on the topic. Yeah, of course, Dr. T, do you have any comments on today's session? Were the questions surprising to you, or what's your impression?
Not surprising, but actually it's great because what I think I know for sure is that it doesn't matter where you are in the world. We all have the same questions about our body. We all have the same desires for health and wellness, and it's actually quite good, to have this today, especially because it is World Contraception Day. And I think giving information that is evidence based, that is credible, is really, really important because there is so much information out there, and sometimes young people don't often know what is good information and what's credible information. And I think it's really important for us to contribute to creating a world where young people can have good information to make better choices for themselves, to make more informed decisions, and also, encourage them and encourage all of you watching to consult with your healthcare provider if you have any questions. Don't feel judged, don't feel shy. Most of us are actually going through the same thing, right? We tend to think that we are the only ones going through something. But I can promise you that there isn't a question that we haven't heard before with Ralph, also a doctor, and we remain, available to assist you even after this session. If there's more questions, in the comment section on social media, we will definitely be attending to those. And it's really just been a good day to spend sharing more information and, advocating, in the different ways that we work, Ralph, to ensuring that services for young people exist and that they are dignified and that they are of quality. So thank you so much also, for spending your morning with me, Ralph. It's been really, really great.
Yeah, I'm looking forward to continue that because we could have talked for hours and hours on the respective topics because it's so important to share that information and to, let's say, enable women to think about what they really need in terms of contraception, and to speak up when sitting in front of their doctor to get information on something regarding contraception or on the right method, which may help them with any symptoms, whether it's the bleeding they want to get rid of or minimize the headache and the pelvic pain around that. Sometimes also it appears that libido goes down, yeah, when taking hormonal contraception. Or why is that? There may be a different contraceptive which may help you also with that. So you can do something about that, but you must speak up in front of your doctor because he or she can give you, based on that, the right contraception. Change your method, change your brand, whatsoever. So it is your life. Be safe, stay healthy, and find answers to many of today's questions and much more information about the different method of contraception. We have created a nice website which is called www.your-life.com. It's available in English, French, and Spanish language. And really, really every year I have to review it, and it is so nice to read it out. And it is so important, and it is written in lay language. Everybody can understand it. You can make a quiz on which contraception is right for you, and you can get a full understanding of the contraceptive landscape. It's worthwhile visiting. It's very nicely drawn. And it is supported by many non-governmental organizations. So it is not a pharma advertising website. No, no, no. It is supported by the WHO, by European societies, and by Bill and Melinda Gates, just to mention only some of them. So it's really neutral. It's worthwhile having a look on there. We really enjoy talking to all of you openly about contraception. We also thank you for the great questions and your openness. And if you want to share your feedback on that session, if you like it or not, go to menti.com, menti.com, and use the digit code displayed in the crawler below. Or much easier, take the link provided in the comments and give us your opinion. It is just a very simple questionnaire that would form also the way of a potential continuation of a second round about that. So let's keep in touch. Stay healthy, be safe. It's your life. Bye bye.